So let's bring into the stream Dr. Adrian Burrowes, who's a family medicine physician and CFP at the Physicians Group, as well as CEO. It's good to have you here, Dr. Burrowes. Thank you for joining us. I guess it depends where you are in the country to be able to say that it's peaked and now declining. That's at least the headline we're getting in New York. What do you think is truly going on with this nationwide?
Well, thanks for having me on, first of all. Secondly, though, you're right. Depending on where you are geographically in the country, depends on where you are in terms of whether we feel that Omicron is reaching its peak or whether, you are past the point of having to worry. So, I'm in Florida, and so the data is showing that we are coming off of a peak. So hopefully we'll be looking at, less cases. Last week, we were inundated with cases. You still can't get into the hospital. If you get admitted to the emergency room now, it's taking you almost 2 days to get admitted here locally in Orlando, where I am. And, I just think that people let their guards down. We do have a variant in Omicron, which is much more easily transmitted. And I think you're seeing that as you go across the country.
Doctor, thank you so much for joining us. In your state, there has been an inquiry in Florida that just opened into Dr. Ralph Pino, the director of Florida Department of Health in Orange County, to determine whether he tried to press employees to get vaccinated in violation of a state law prohibiting government agencies from implementing vaccine mandates. What impact do you think this state law and now an inquiry towards an official who may have violated it, what has that done for vaccination rates in Florida?
Yeah, so first of all, I will tell you that the Governor DeSantis has been, I don't want to call him anti-vax, but he certainly has not been a proponent of what I consider doing the right thing and trying to promote vaccination. The gentleman that you're referencing in public health, he's not asking for a vaccine mandate. He's simply saying that those people who are working in public health are not being vaccinated at the same rate as the general population. And he's encouraging them to do so. So that puts Governor DeSantis in an awkward situation. He's not mandating vaccines. He's encouraging vaccines, which is a First Amendment right. Governor DeSantis has always been about freedoms of speech and things of that nature. So does he try to fine this gentleman for violating the vaccine mandate law, or does he stick with his mantra of freedom of speech? So that puts him in an awkward situation. So I'm interested to see how he handles that.
Your Governor DeSantis, won't even admit if he got the booster shot, whereas the former president, who's a resident of Florida, has talked about getting the booster shot. How difficult does it make it for doctors when the state's leader takes that kind of position?
That's a wonderful question. It makes it very, very difficult. We have been struggling to try to get control over our infection numbers here in Florida. And so when you have the leader, the people that people look up to in terms of directing us and trying to help us get control of this pandemic, not supporting the health care officials in the state, it makes it very, very, very difficult. And it's confusing to the patients. It's confusing to our residents. And it certainly is not making my job any easier.
I want to shift gears for a moment and ask you about data that you're seeing around long COVID. So those who were previously infected but may still be experiencing some symptoms of COVID-19 months after that initial infection. Are we seeing any data emerge in terms of who's being affected most by this and how to alleviate some of these lingering symptoms?
Yeah, so, people who are, at high risk for developing COVID are people who you're starting to see these, prolonged conditions with, where they're getting, scarring to the lung tissue, having prolonged periods of shortness of breath, unable to return to their normal quality of life. But I will tell you that is actually trending into people that, you would have considered having healthy lifestyles. So the high risk patients, as we have identified them, are not the only people who are having these long COVID symptoms. And so that's why I try to urge everyone I can to try to get vaccinated if they're eligible to be vaccinated, because we're definitely seeing less of those symptoms in the vaccinated population.
It's a hopeful question I'm about to ask you, but it's a light on the horizon question. Do you have in your mind a date by which this really is going to be behind us?
That's wonderful. And people are really anxious for that. I don't think anyone really thought we would even last this long. Historically, pandemics tend to last roughly 4 years if you look back in history. And so I would hope that that would be the light at the end of the tunnel. I know some people are getting very excited about what's happening with Omicron, if you can get excited about something, because it's really increased the amount of people who it's affecting. So I think people are trying to hope that, we'll develop herd immunity as a result. But I tell people, we thought the herd immunity number would be 60 to 70% when this first started. For Omicron, we're talking like probably 90 to 95% to achieve, that type of immunity. So I tell people, don't worry about those types of things. Worry about what you can control. We cannot control coronavirus, but we can control whether we get vaccinated, whether we wear masks, whether we social distance, whether we wash our hands. So I tell people, those are the things you can control. Those are the things you should be doing.
All right, Dr. Adrian Burrowes, family medicine physician and CFP Physicians Group CEO, thank you so much for joining us, and thank you for your time this afternoon.